Good afternoon, ladies and gentlemen. This is the boring tax bit. This is the penance. I suppose when I joined the Irish Heart Foundation, I thought I'd be spending my time talking about nice things like healthy living and nutrition and physical exercise and happy hearts and things like that. But I suppose really my work over the last 5 years could probably be summed up in 2 words. You've seen them before. I know this came up a bit, and I suppose you were probably all as disconcerted as I was when the Grim Reaper came up behind the Archbishop. And I just hope the Phoenix don't get a copy of it. That's all I can say. So I suppose cardiovascular disease is Ireland's biggest killer. That's why we spend a lot of our time talking about death. And our biggest priority has been to reduce levels of avoidable death and disability caused by chronic service deficits in both acute and rehabilitation services for stroke sufferers and people with heart disease. And happily, that part of our work is going well. That's the death. The taxes, our achievements on those have been a little bit more of a mixed bag. Taxation really spans our entire advocacy agenda. It incorporates issues relating to the prevention of cardiovascular disease, preemption, crisis and post-crisis. We obviously want the VAT burden on charities removed as well, but because taxation is one of the most potent weapons available to governments in setting effective health policy, more often we're actually looking for tax increases than tax to be removed. Our key current areas of interest tax-wise include tobacco, and I've some of our allies in the Irish Cancer Society are here today. I suppose sugar-sweetened drinks is another big area we work on, alcohol and that sort of thing. And we're also working on specific VAT issues around defibrillators, VAT on defibrillators and VAT on nicotine replacement therapy, as well as supporting the ICTR in its work around VAT on charities generally. I suppose just briefly to mention, sugary drinks tax is a particular priority for us at the moment. Ireland's the only country in the world that's carried out a health impact assessment in this area, and it shows that a 20% increase on sugar sweetened drinks tax would reduce our obesity levels in Ireland by 3%. That's 22,000 people. And if you actually then spent the money raised from the tax in areas, that would be in the region of 70 million euros. If that was spent on financing a children's future health fund to help alleviate childhood obesity and food poverty with initiatives targeted at disadvantaged areas, that impact could be multiplied, and we could actually start making some realistic progress in that area in undoing the damage that's being caused by our obesogenic environment. Everyone knows about tobacco tax, and that we went to 10 euros for a packet of cigarettes in the budget. That's good. That's the sort of the foundation stone of the reduction in smoking rates down to historically low levels now, and lower smoking rates among children in particular. And I suppose it's also the cornerstone of the government's policy of creating a tobacco-free Ireland by 2025. VAT on defibrillators is really, it's one of the most unconscionable tax anomalies I've come across out of a lot of unconscionable tax anomalies, and it's a cause of acute anxiety to the Irish Heart Foundation, and particularly core stakeholders that we've got, such as people living with inherited cardiac conditions. Every year, 5,000 people die in Ireland from sudden cardiac death, and about 100 of these cases are people under the age of 35. In the event of a cardiac arrest, there's an 80% chance of survival if a defibrillator reaches the victim within 2 minutes. And each year in Ireland, roughly 125 lives are saved directly by defibrillators. There's VAT charged at 23% on these machines, and so clubs and organisations that fundraise, to help protect their members and potentially to save a life, are taxed by the government to the tune of roughly 500 or up to 500 euros per defibrillator. That's a prohibitive cost in many cases. It reduces the number of defibrillators, which reduces your chance of being saved in the event of a cardiac arrest, and it also reduces organisations' ability to pay the cost of training that's as crucial as the machine itself in terms of saving a life. It's now accepted, after many years, it's now accepted that VAT refunds are permissible if they enable individuals to overcome a disability, and I suppose what bigger disability can there be than your death? But not for charities, not for clubs, and not for organisations. It's a welcome small step, but really it might satisfy the letter of the law, but it makes absolutely no sense whatsoever in health or in human terms. The government insists that none of this is their fault, of course. They're bound by EU regulations stating that VAT must be paid by the final consumer, and that the VAT can't be reduced and abolished on defibrillators. They also point out that while there were refund orders in the past, there haven't been any for many years. The European Commission agrees that Ireland can't remove VAT on defibrillators, but it has now said that the government can compensate purchasers through a grant system. We've only recently got a response to that, and it's as lame and as misleading as you like. The government says that to date funding has been separately available to groups that provide defibrillators. Now, the truth of that is that whatever funding is available to individual GAA clubs or the Irish Heart Foundation or CRE who are here today, anyone else who might buy a defibrillator as well, nobody has ever got a cent back, not a cent back for a defibrillator from the state. So really what they're saying is they provide some funding for organisations through various means, but it's misleading to say that they're providing it for this. I'm sure a lot of this, or probably all of this, is painfully familiar to all of those who've been involved in the ICTR's VAT campaign over many years. Even when you've proved that action can legally be taken, that there won't be any unintended consequences, and that it's overwhelmingly in the public interest, you can still be thwarted by technical rules or technocrats in the absence of political will. The issue of nicotine replacement therapy is equally ludicrous. The government policy states that Ireland will be tobacco free, as I've said, in 2025. 80% of smokers want to quit. So will the government help these smokers beyond reducing their cravings by taking 1.2 billion a year off them in tax every year? The answer is resoundingly no. The state spends 1% of what it takes in tax helping smokers to quit, and then it adds further financial insults to further financial injury by penalising people who try to quit through 23% VAT on their patches, their gums, their inhalers, and their nicotine tablets. Sorry, there's a. Sorry. So when it comes to VAT on charities or on items like defibrillators, EU law is set in stone. VAT must be paid by the final consumer. Well, actually not. If the government really wants to do something on VAT, or if there's a vested interest important enough, it seems there's plenty of wriggle room for them. And there's two examples just from last month's budget alone. An increase in the flat rate scheme compensating unregistered farmers for VAT incurred on their farming inputs, and retention of the celebrated 9% reduced VAT rate that was introduced 3 years ago as part of the government jobs initiative for tourism. Sorry, one of the slides just jumped into a different position there. So I suppose certainly nobody could quibble with any of these charitable exemptions on VAT that Revenue describe as specific reliefs from VAT in certain circumstances, quote unquote, which may be availed by charities where appropriate, and fair enough, clearly limiting their exposure on them. All of these make perfect sense. They're all fine. Nobody could argue with them in any way. But why are these ones in and other equally worthy possible derogations left out? I suppose it might be hard for some of us to recognise the difference between saving the life of a drowning man in a small rescue craft and saving someone's life after a heart attack with a defibrillator, but in VAT terms, these are a world apart. All of these exemptions were introduced between 1980 and 1995, and I suppose the only feasible explanation that there's ever been came in the Ernst & Young report that was done back in over 10 years ago for the ICTR, that described this as being the likelihood that they were the product of successful lobbying. So I suppose all of this shows that successive governments have been making up rules around VAT as they've gone along for years, and if rational arguments are ignored, I would think maybe it's time for a bit of old-fashioned and well-deserved ridicule, because the law in this area really is an ass, and I'm very happy this slide didn't come up when the Archbishop was speaking. I suppose the theme of this gathering today has been embracing new realities, but I really here we're going back on hoary old chestnuts in terms of VAT on charities. This is an issue that Sheila and many others have been working on for decades, probably rather than years. Sorry about that. And so I mean, I'm sure there's most people here are more familiar with, than I am with the ICTR's campaign, and how it's come agonizingly close in the past to positive action, only really to be frustrated by changes to the non-permanent government. As you all are very well aware, charities pay an effective levy of unreclaimable VAT on activities such as capital expenditure, fundraising, promotion, essential equipment, etc. And I suppose there's a number of reasons why I would think that this area needs to be remedied now even more than it has done in the past, and not least of those reasons is that the services that many charities provide have been whacked by the double whammy of the economic collapse on the one hand, and then the sectoral scandal that has been talked about already. People have become unsure of where their donated euro is going, would certainly not be happy to realise that a chunk of what they've already paid for in income tax is also going into the coffers of the state in VAT. Likewise, VAT is hampering charities, particularly those that engage in a lot of event-based fundraising activities, in reducing their costs so that more money can go directly to the cause. And this really, I suppose, also promotes over-reliance on state grants. At a time when the government is also finally regulating charities, it sends out a madly mixed message that yes, we want you to be more professional, we want you to change, but we'll charge you through the nose for professional fees such as accountancy, legal services and training that will improve your competency and your good governance. So in terms of the Irish Heart Foundation, I suppose we're quite a good example of a well-known charity that's being hit very hard by VAT rules. We raise in the region of €5 million a year through fundraising, and we receive about €300,000 annually from the HSE for our Heart Month promotion, and that's usually all the state funding we get. On the other side, almost 10% of our fundraised income, €450,000, goes to pay VAT, mainly on advertising, print and design, and the information and awareness campaigns that are our core product, if you like. So in fact, we're actually a net funder of the state beyond our normal tax obligations, albeit an enforced philanthropist in this circumstance. One particular example, we ran a fast campaign on awareness of stroke. It was the biggest awareness campaign that we've ever run. The purpose of this was to ensure that people recognise the warning signs of stroke and get to hospital in time to receive potentially life-saving clotbuster treatment. The National Awareness Campaign increased awareness in this area from 30% of the adult population to 87% of the adult population, and this played a crucial role in a 13% reduction in stroke deaths over the last 4 years, and a 28% reduction in the need for nursing home places for people leaving hospital after stroke. And according to the National Stroke Programme run by the HSE, the saving from these changes is in the order of at least 22 million euros every year. In the UK, the government has paid to date around £15 million to promote FAST. Here, there's been no state support for this programme, and of the 525,000 that we've paid in the Irish Heart Foundation to promote this awareness, roughly 125,000 of that has been paid in VAT. So again, we're being penalised for saving citizens' life, but we're also being penalised for saving the state money. We know that since the TV element of the campaign ended, there's been a reduction. The awareness has stayed the same, but there's been a reduction in the number of people getting to hospital in time for treatment, and it's very clear. It's very clear to anybody who's looked at it that spending the amount lost in VAT on more ads would save more lives and actually save the state more money as well. We're very small in the Irish Heart Foundation compared to a lot of other charities in the room and in the country, and the VAT bill incurred by St Vincent de Paul, for example, is nearly as big as our entire annual income. And again, I mean, there's just some horrendous examples of the cost, the human cost of this tax. You know, in terms of St Vincent de Paul, you know, it's literally at times taking food out of the mouths of children, and in a country that's played you know, a genuinely good role in alleviating world hunger, you know, it really is. It's beyond sort of, you know, why are we doing this when you know, it's not something anyone wants to do. It's just there because it's a rule, and there's a number of other examples there. I think the Build for Life one is particularly stark, where again this money has been raised. It's been raised by very good people. The money's been given by very good people, you know, for a specific life-saving cause, and the government's screaming off a large amount of that, you know, that again could go to provide services that will save lives and save quality of life for many people. So I suppose those examples there are some of the, you know, some of the individual impacts, and then this is an ICTR slide just on the overall VAT burden, and that is based on a sample of just over 218 charities, mainly members of the ICTR in 2010. So out of 1.7 billion, 77 million is going on VAT, and I suppose just having looked at other examples, I think, you know, probably around half of that would relate to fundraised income that the compensation could cover. Here's another slide just on the sort of the breakdown and charitable activities and building costs, or the charitable activities and property and office overheads are the two biggest areas by far. So just in conclusion, the VAT burden on charities is clearly unjust. In some respects, it's also clearly immoral. It's against the interests of the state in some respects, as well as against the interests of charities and the people that charities serve. It's not the product of any coherent or thought through policy, and it doesn't exist because at some point in time it made any sense. It's there because that's just how the system evolved, and because nobody so far has been bothered enough to reform it at EU level, or even to take the straightforward action required at national level to compensate the people and the charities it affects. The proper application of taxation in Ireland won't reduce the certainty of death, obviously, but it can certainly, in terms of people with cardiovascular disease and many, many others, it can certainly prolong life and improve quality of life, and we really have to ensure that policymakers regard progress on tax reform as essential and not optional. Thanks very much.